Okay, megaesophagus. So I think we all know that normally the esophagus is a long, thin tube that connects our mouth to our stomach. And the way it works is peristalsis, which is a muscular contraction that takes our food and delivers it into the stomach so that it can be digested. The other really important thing that people don't realize is the peristalsis, when it's propelling the food down, it also closes off the airway, which is pretty important because when food and liquid go in the airway, then we get aspiration pneumonia, and that's a big part of this, as we'll see. Megaesophagus, mega means big, it just means big esophagus. And what happens is the muscles completely lose their tone, and so they can't perform the peristalsis, they can't move the food from the mouth into the stomach. So what does it do? It just sits in there, and the esophagus turns into this giant dilated flabby sac. And it is thought that the lower valve that connects the esophagus to the stomach, there's like a sort of a valve called the lower esophageal sphincter, which I'm going to call the LES. It fails to relax and open for some reason. It's a neuromuscular thing, and when it happens, puppies can improve over time. Some of them all on their own. If you can manage them and keep them from dying, they can actually outgrow it. It's not common, and we lose a lot of puppies to megaesophagus, sadly. There are certain breeds that we all know are super prone. Great Danes. Oh, here, hang on, sorry. I'm gonna just let it freeze it whenever I don't have a stupid expression, but I usually do so. Great Danes, Irish Setters, Newfies, German Shepherds. German Shepherds used to be the breed we saw all the time. Labs, Shar-Peis, I've not seen that. Mini Schnauzers on the list, I've never seen one. And Doodles, we're not sure. We see a lot of it in Doodles, but also everybody owns Doodles now. So who knows if that's statistically significant? I do not, but so far so good. Couple of terms that I use, I just want to run over because I think it's confusing, the way you classify megaesophagus. It's congenital or acquired. That's one way. Congenital basically means you're born with it. So we see this in very young puppies. They're usually diagnosed by 3 months of age. If they have a mild case, or the owners are just like, yeah, my dog spits up, sometimes we don't see them, diagnose them until they're a year old. Acquired just means they have managed to acquire it somewhere along the line as an adult. So a lot of people talk about those are the two classifications. Another classification is primary or secondary. Primary just means it's idiopathic. That's a great word. What does it mean? It means we don't know what causes it. I always tell people it's just because vets are idiots. So that's a way to remember what idiopathic means. Secondary megaesophagus means the dog has another disease. It's not a primary or idiopathic megaesophagus. Examples of secondary disease, if it's a puppy, is called a vascular ring anomaly, more specifically a PRAA, which stands for persistent right aortic arch. It's an embryonic malformation of the blood vessels that forms a stricture that tightens and fix this. Sometimes it doesn't fix the megaesophagus, but it has the potential to. So that would be called secondary, even though it's in a young puppy, even though it's congenital, it's not idiopathic because there's a cause that we can find. So, not know the cause. It's just a freak thing like so many. As far as an adult, acquired secondary megaesophagus, myasthenia gravis, is the most common thing, probably about 25%. Now this is important because it's a treatable disease. It's specific testing. It's an autoimmune disease where the neuromuscular junction is destroyed. And if you find it and you test it, you can treat it. And then the megaesophagus hopefully improves. Megaesophagus does not always improve with treatment. That's one of the frustrating things. Addison's is another disease that can cause megaesophagus. Addison is just a famous disease that can do anything it wants, and I'll leave it at that. There's a rare neurologic disease called dysautonomia. It's more common in England, I believe, but basically it affects all the nerves, and that disease is hopeless. So if you ever manage to diagnose it, I've never seen it, I've never diagnosed it, there's nothing you can do. And then things like trauma, inflammation, strictures, you know, that would be a pretty rare thing of esophageal disease. But we're left with, most of the time, we have no idea what, so that's why it's called idiopathic. Age, whoop, hang on, oh, computers. I was trying to find statistics, and I think some people say like a third of them, if you can manage them through puppyhood, they might just get better. But unfortunately, a lot of them, you know, succumb to aspiration pneumonia or are put down by breeders. They still don't know the root cause of idiopathic, but it's something to do with the nerves just don't develop properly. Symptoms. It's pretty classic, and it can be mostly diagnosed with symptoms, but the big hallmark is regurgitation. Sadly, a lot of owners come in and say, my dog is vomiting, so sometimes we just forget to ask more questions. Vomiting is an active process. It's retching, it's heaving, it's a forceful expulsion of the food contents out of the stomach. Vomiting dogs often will show nausea. You'll see them licking their lips or drooling, and you know, we all hear the retching and we jump up. Regurgitation is different. They're walking along and they go, and the food goes flying out, and you're like, oh, that's weird, I didn't hear him retching. After a while, you realize this is regurgitation. So you're savvy vomiting, but you know, sometimes we get busy and we believe them. And so we're like, oh. Other things that present, oftentimes it's just that they're so tiny, weight loss, they're malnourished, they're not getting nutrition. So a breeder will notice that, you know, they're half the size of the litter mates and they're spitting up. Some breeders report a bullfrog funky noise, and some report that they can see like the bulge of the esophagus, like when it's full of food and it's just a bulge. And I've actually seen this in a doodle. It was like incredible to see. Sadly, another sign is they come in with aspiration pneumonia, like, oh, that's weird for a puppy. And it turns out they have it. And then the final symptom is oftentimes these puppies are crying. They're not satisfied because they're either hungry or they're painful because you got a big ball of food stuck in your esophagus. That's gotta hurt. Diagnosis is pretty straightforward. We usually have a pretty good idea. A lot of breeders are savvy. They come in, they say, oh, I got a Mega puppy, and you know, we can confirm it on x-rays. Once in a while, if it's a little tricky to see, the ideal gold standard to confirm is barium, because then it's very clear. And the only thing is there's a slight risk if you give barium, you know, it can end up in their lungs, which, you know, that's bad too. X-rays can also look for underlying conditions. And again, you can see if they have aspiration pneumonia, or you can see if they have that vascular ring anomaly, the PRAA. It'll show up as like the esophagus just looks like a big balloon with a stricture, and then so it's like an hourglass shape sometimes. So X-rays are helpful to confirm, but usually you have a pretty good idea. Treatment. I hate computers. Hang on, okay. So there is no cure to date. Lots and lots of things have been tried. Surgery has not been found to be helpful. I'll follow if you have that, and then it's not constricting the esophagus anymore. That doesn't mean they always get better, but at least the stricture is gone. And you're going to hear a little bit more about that later. It basically boils down to management. Many medications have been tried and tried and tried. Most all are simply not helpful. Common ones are metoclopramide, which you all know as Reglan, cisapride, famotidine is Pepcid, ondansetron is Zofran. They usually fall in the category of either motility drugs, antacids, or anti-nausea, anti-puking drugs. But they really haven't been found to do all that much. So you end up with lifestyle management, and we have a awesome person who's going to completely demonstrate this, so I'll just buzz over the high points. Number one is food consistency. Now, the interesting thing is it's not a one-size-fits-all. Some dogs with ME do better with liquid, some do better with meatballs, some do better with dry. You have to experiment. You got to figure out what works the best. A lot of the board-certified internal medicine people seem to like to start with meatballs, but it really is a trial and error. Stick with what works for your dogs. Number two, small, frequent meals. Never try to give them a big, a giant meal at once. Elevated feeding is the cornerstone. Bailey chair is the most common. If you have a dog, you're going to keep it for life. Most people have a Bailey chair. Other people feed them on step ladders, especially if they're trying to get them to outgrow it. That works too. In rare cases, a feeding tube, if you have a really devoted owner or breeder who wants to do everything, you just bypass the esophagus, put the food directly in the stomach, it works. Most people aren't really up for that. And last, there's a type of collar that's going to be demonstrated by one of our next speakers. So I'm going to leave all that page up to them because it's a lot better to just see than try to explain it. So what's new? Viagra, sildenafil, thanks to Sterling. And in defense of myself, she will tell the story. Came in and told us, and she was seeing Kate, who's one of my co-workers, and we had a 7-vet clinic, and I think the quote was, she looked at me like I had two heads, and like, we can't do that, and typical. I was like, what, Viagra? Well, it turns out there's a tiny clinical study that they did in Italy, I think it was in Italy, of 21 puppies, and it was a proper study. It was a randomized controlled study of 21 with congenital idiopathic megaesophagus. Here we go, hang on. And it was properly done. They were divided. It was a double-blind study, placebo-controlled study, meaning they were put in two groups, and the people who were evaluating the puppies had no idea which puppy was in each group. That's a double-blind placebo-controlled. Placebo meaning half the puppies got a placebo and half the puppies got sildenafil. That's the real name for Viagra. They did a mg per kg for 14 days only, and then they evaluated clinical signs, which was frequency of regurgitation. Did they gain weight? That's a big one. And they were able to measure the esophageal diameter, and they showed clinical improvement in all three. And it was thought that the Viagra reduces the LES tone, that's sphincter. And so that allows the food to go in. The dose we'll hear later you can play with, but that was the clinical trial, and it was statistically significant enough that then the word got out. Thankfully, the breeders knew because us vets didn't know. But they also found in a study that the x-rays clinically improved, which I think is amazing. Now, there's tons of anecdotal stuff since then, and again, who knows when I would have stumbled across it if it weren't for Sterling. And that's the other thing. They have the experience. I don't know what's happening here, but the breeders have more experience, and they talk among themselves, and there's tons of anecdotal evidence. In defense of myself, I know a ton of vets, and we hang out together, and a lot of them are brilliant and smarter than I am, and I asked them all, and they're like, no, we don't treat Maggie with Viagra, really? So I feel a little better. But so then there's two case studies that I personally know of, and the first one is Sterling's, and she, was smart enough. She did like trial and error and realized that, okay, the twice a day doesn't work when you're feeding baby puppies because they might eat 3 times a day, or in the next case, 5 times a day. So she figured out the trick is you give it, 5 to 10 minutes before the meal. You want to use a liquid form, and you still do the elevation. You hold the puppy upright to let the food get down. Her Sterling's Great Dane was diagnosed at 5 weeks, confirmed with X-ray. I just double-checked these with her. She started therapy by 6 weeks. I think she probably had to convince us for a week and get the drugs. And she worked with it and figured out the best way to do it. Like, we had no clue. We're like, I don't know. But she was able to wean this dog off completely by 7 months. And, you know, God bless. I mean, it totally worked. And the dog then went to a permanent home, and it got x-rayed later. I believe Sterling said the dog ate a sock, and so they shot an x-ray because of the sock and looked at the esophagus, and it was completely better. And the dog is now 3 to 4 years old, completely normal, no medications, and no management. So Sterling also knows personally of 2 breeders that tried it, and the puppies failed. And I don't have stats on how many puppies have been fixed, and I don't know where to find them. The second case was a Saluki, which also belongs to a breeder friend, and I had happened to have been chatting with her somehow, and I don't even remember what, on Messenger the night before, and she happened to mention this puppy, and it was really sad, and she was pretty sure it had M.E., and of course she was right, and she was probably going to have to put it down. And I was like, no, Viagra! And, you know, I'm sure she thought I was nuts, like I thought Sterling was nuts. And I'd like to say that I helped the puppy, but what I did was put her in touch with Sterling, because I didn't know details of how you do it and how often and how much. Her puppy was then diagnosed at 3 weeks, confirmed by taking it to her vet, and she treated this puppy until it was 3 months and a week. So that's pretty quick, and weaned it totally off. It's a normal, hell-raising Saluki to this day. I love her. But she also had to work through a lot of, again, this puppy was tiny and sickly, so she was feeding it 3 to 5 times a day. So she asked me, so what about this and that? I'm like, hey, well, we had a 3-way messenger group going forever, and it was awesome because, you know, Sterling had the answers because she worked through it, and I'd be like, oh, no, ask Sterling. But this puppy, I mean, I'm thrilled. It was a miracle, and all I did was like, hey, try Viagra. And so now I like preach to the choir, and I'm like, just tell everybody you know, because, again, my vet friends that are really smart, they don't know about it. There's some other studies going on. Missouri's doing something with mechanical or surgery. UPenn, Washington State University, Clemson University, UC Davis has an interesting one that they're looking at stem cell therapy. So who knows? Viagra does not always work. We're yet to, we need a bigger study. We really, really, really need a big study, and I would think that somebody would fund it, maybe Viagra, as I run off to buy more stock in Viagra. But, I mean, what can we all do? Spread awareness, because there are so many people that just don't know this. For a general source of information to look stuff up, these 2 articles that I think Jenna has a link that Carolyn Coyle wrote both of them, and that's what I referenced, and one was about her own journey with Mega E, and that helped a ton spread the word. And if you're Googling online, VIN is the Veterinary Information Network. It's our chat thing, but they have a public thing called Veterinary Partner. You can find articles on almost anything. So I want to thank Debbie Burke, who's going to do the demo with her actual dog, and then Michelle Ridenour, who is, I think, going to pop on and tell her little story with her dog. Sterling, who, like I said, is why I'm here. And then Carolyn Coyle, who's done more than anybody to make this knowledge public and help spread the word. So, up and away. Who's next?
Thank you so much, Chris. I am now going to pin Debbie right.
I think her dog is ready.
Her dog's been ready.
Yeah. Well, this is Kaylee, and she is past dinner time, so she's a little upset with me right now.
No.
Yeah. Kaylee was diagnosed at 4 or 5 months when she came down with aspiration pneumonia. And we had some idea of what megaesophagus was, but, you know, it was like, no, please say that's not it. So they got her through the first pass, and we treated her with kid gloves through the first year, feeding upright with the meatballs. The idea of the meatballs being that the weight of them, if they don't chew them, the gravity will let them just fall right down to the stomach. And she did really well with that. And being a puppy doesn't like the restrictions. And as time went on, we were feeding the Knox blocks because hydration is just a nightmare if your dog can't keep water down, comes back up and aspirates. And a lot of people make gelatin blocks to hydrate their dogs. So we were doing the whole thing. And then she would go out in the backyard and eat poop or stick her head in a puddle. Or and there are any 7 to 10 dogs in the house at the time, so keeping water isolated. There's challenges. There's definitely challenges in a multi-dog household. So over time, we started to think that her case was very mild. And to be honest, I think other than, you know, the aspiration pneumonia incidence, it is pretty mild. But we weren't treating it for the longest time, and then we hit January of 2020, and everything, we had a meltdown. But so let me just back up before I get into all of that and just do some of the basics here for you. Kaylee's wearing a neck hug right now. This is because, you ever seen those commercials where they're talking about people keeping their neck aligned where they're sleeping and their spine is this way, and if they're on a regular pillow, their head dips down like that. And then if you're going to get a pillow to keep your spine aligned and your head aligned, everything is in a nice straight line. And that's the purpose of the neck hug. It doesn't let her drop her head down when she's sleeping or lying down, because, as you know, when a dog regurgitates, they don't get the signals that shut off their windpipe. So it's really easy to aspirate food or anything else that they don't know what's coming up. So that neck hug, this lovely little pink fashion statement, is just a precaution that that we take. We pretty much make her wear it 24/7, and she doesn't like it. In terms of the food consistency, we went away from the meatballs after she started, you know, leveling out 2 to 3 years old, and we went to feeding her straight moistened kibble. And then when everything went kaflooey last year, 2 years ago, last year, we messed around with food consistencies again, but then discovered that her body really just did want to eat moistened kibble. That it works best for her, it slides down, but it's solid enough that it's not going to get stuck. So what I do to deal with a very hungry dog who wants to gulp her food and possibly get it all jammed up is I feed her by hand, and I have, no, don't help me, and just control the speed of what she wants to eat. We do manage to keep it down to 2 meals a day, and she's getting 1 3/4 cups. And she's still a pretty active girl. She's 5.5 going on 6. So now that I've got her going, I can tell you what, there's a good burp. We live for burps. In December, gosh, I guess it was just a year ago, she choked while eating and managed to suck down something, and I can always tell when I start hearing the glucking right here. If I held her up to me, her breathing's funny, and I can hear a rasp and a glucking in her throat at night. And I'm hypervigilant mom, and I rush her to the vet and spend crazy money. And I've been wrong sometimes, taking her in, and there's been nothing wrong. But this time I was right, and something changed with her disease, and it hit a turning point, and she started aspirating. So then we started messing with food consistencies, and that didn't work. I think she aspirated 7 times between December and the end of February. She developed a resistance to Clavamox and Baytril, and we ended up, boy, Chris is going to have to help me with the name of the injectable antibiotic that begins with an M. That's one of the heavy-duty ones, and
Is that the trade name or the brand name? I don't.
Oh boy.
Convenient, which is a cephaloxin. It's a like 500th generation cephalosporin, which is great for aspiration pneumonia.
I don't know. All I know is I did not like giving her shots, and she did not like it either.
Oh, was it daily?
Twice a day.
Oh, amikation?
Twice a day. I'm sorry, no, I don't have...
Enrofloxacin? It doesn't matter. It doesn't.
Yeah.
I had good luck with the long-acting injection, but everyone's different.
No, you're not eligible. I was, I lived in that parking lot for 2 months. I slept there. Every time I turned around, we would think we had it under control, and I'd run her back in, and they'd run another x-ray, and there's another spot. And I started working with internal medicine specialists there. And as you know, many vets don't treat a lot of this. And Kirsten, God love her, was involved and gone to school with somebody who was involved with one of the studies, and called her and said, you know, we can't get this dog under control. And she said, what about the sildenafil? Because what we're seeing is when she regurgitates, it's hours later, and it's coming back up in the kibble form. So it's not digested at all. It's not coming out of the stomach. It's not ever making it to the stomach. Lower esophageal sphincter. You're going to drink this? No. So her friend at the study said, you know, there's not a lot of studies on it. It's anecdotal. I'm not sure it works. Like, give it a try, because what do you got to lose? You're going to lose this dog. And at the same time, we got back into all of the preventative stuff that we hadn't had to do for a very long time, and that being the, you know, the neck hug and the burping and the Bailey chair, which, you know, you don't want to buy a Bailey chair for a growing dog, but she had hit 4 years old now, and I'm like, that's it. We can't slack off on this anymore.
I had a client with a golden, sorry to interrupt you, she managed that golden retriever from puppyhood to 13 with just a Bailey chair. I think it had aspiration pneumonia once, but that's unusual, and your experience was more unusual. So sorry to interrupt. Go ahead.
No, that's okay. Anyway, we got it under control, and I'm now absolutely hyper that I won't let anybody. There we go. We got one big burp. I don't want anybody else taking care of her. She's doing pretty good, and I have an intact male dog in the house with, you know, co-owners, breeders, situations, who I really did not have the option of neutering, and so, telling tales out of school here, he has Wobbler's disease. So my nightmare was an accidental breed. So I really felt I needed to get her spayed, because I had control over that. And everybody out this way in Massachusetts is like, nope, nightmare, not going to touch it, nobody's going to do it, just forget it. So I ended up going to Cornell. I'm from Western New York, and there's a comfort level there, you know, and they specialize in high-risk surgeries. And damned if we didn't take her, and they did the surgery on an elevated table, and she aspirated again. So we got that one under control very quickly, and I'm going on too long, but this is interesting. After she had that surgery, she never refused her food again. She just something changed. And I can't imagine what a space surgery has to do with megaesophagus, but her whole eating pattern, she became a ravenous, wonderful, healthy little dog after we got, and I don't know, makes no sense whatsoever.
You know, that's interesting, and I'm going to digress for about 60 seconds. I have a Saluki with Larpar, and he has a tie back, so I never wanted to neuter him, and long story short, I neutered him a year ago. He used to get aspiration pneumonia all the time from Larpar, and after the surgery, he was a different dog. Bizarre. But yeah. So no, we don't know.
We don't know.
We don't know.
But it's something, when you hit your 4th generation. I'm not a terrible, well, I
I'm
got
just
30 years.
interested to hear you say that, but I'm going to mute myself again so I don't...
No, it's okay. But this is my 4th generation, and I stopped breeding because the simple monetary stress of this and another dog with a serious disease is just, I can't do it anymore. And I'm getting older, and she showed twice, and we're good with that, She's my baby, and I'd do anything for her. Can't think of what else I need to tell you guys. She lives an incredibly normal life, and the only thing, and Celine was mentioning this the other day, is this huge honking Bailey chair she's in down here travels with me everywhere. Oh, that's what I was saying. I don't like to hire dog sitters. I don't want, essentially where I go, she goes. And if we go on vacation or something, she goes with me, and I haul this damn chair around with me and all her gear, and I haul it all over the country. So now she's done eating, so she's going to sit here and want to be burped for 20 minutes, and we figure, and it corrects me about the mechanism that the drug works on. The idea is that holding her upright this long, now that the food is in the stomach, 20 minutes allows it to get into the small intestine and the other sphincter to shut it down there so it can't come back out. Am I right?
I'm not sure about that.
Okay. Well, anyway, folks are asking what a Bailey chair is.
Like, sildenafil hasn't been studied to that extent that I know of. If anyone else knows, feel free to jump in. And I have a question for you. Is the Viagra, she's on it now, right? And is it helping her? And if so, like...
Well, that was the turning point.
Okay, so you think it did help her?
Oh, I do. That was completely the turning point with, yes, it's added into the use of the Bailey chair, which I will show you in just a minute, guys.
Yeah, because we have a question. Okay, thank you.
Yeah, people are asking what it is. But, yeah, with the 3 things we're working on, and...
so it did help her, and what age did you start it?
Pardon me?
What age did you start her on that? Right.
That was 1 year ago. It was January and February of last year. And she is going to be 6.
So she was 5 years old, she started as an adult. Okay.
Right. So let me show you guys what this thing is. This looks like I have a doll or something, and I want to feed her in a high chair. But she sits upright to eat. What'd I do? Taylor, move your head up, honey. And it's putting her esophagus in an upright position and allowing gravity to take the food into the stomach. Okay? And she is trained to, she knows she's going to have to sit in here now for 20 minutes after we're done eating. Outside of this chair, the only thing, she can drink water as she sees fit. I try not to let her, drink a whole bowl of water at a time or anything, but the only other thing that I will give her outside of this chair are some Gerber's baby puffs, because they dissolve right in their mouths, and this is something that folks on one of my lists have determined that is a good way to give them some treats and some reinforcement without feeling left out from everybody. So now we just sit here until that food goes all the way down in, and hope that, as you go with these things, you hope that nothing gets stuck in a pocket if they have any pockets bulging out of the esophagus that food can stick in, and then it rots. And it's another great great thing for the aspiration pneumonia is that if they're inhaling rotting rancid food when they regurgitate, that's just another nightmare for the insides of the lungs. You know, it's septicemia and anyway. So that's what we got. Anything else I can explain to anybody? Or?
Can I actually ask a question really quick? With the food getting stuff like in a pocket, I know when that happens in the intestines, it causes diverticulitis. Is that something that happens in the esophagus then?
I don't know.
Okay. That's one thing.
That's a better question for Chris, I think.
It certainly could. It's certainly not common. And so the whole esophagus is a big diverticulitis. I mean, it's one. So it's not like it's a muscular tube with one area. Like, you're right, diverticulitis is a little pouch in the GI tract, but this is different. It's the whole esophagus. So you don't really have a diverticulitis in the intestine. It's intestine, pouch, intestine.
I guess maybe it's one temporary pouches that portions of it can just pooch out and kind of go flaccid and have a little, I don't necessarily think it's a permanent pocket, but I know that she tends to get an area that balloons out.
Well, it's a part you can see that in a lot of breeders
Right in here.
With their puppies, because that's the area that you can see it.
Right.
But as the esophagus goes down, it's pouching, but you can't see it.
Right. And you can
occasionally a localized pouch, but that could be gone. I mean, I don't know.
our initial vet told us that they saw something very distinct on the barium swallow that they saw again. And again, I don't know. I just try to work with mechanics. Yeah. And the severity of the illness, the severity of what goes on with different cases of megaesophagus is astounding. I have never seen this dog regurgitate, maybe once, but I've never seen him do it. There are other dogs that owners will get on the Facebook group and post who've been throwing up foam all night long and I don't know what to do, and they talk about having, specialized cleaning products for all the regurgitation that goes on. Some horrible, I don't even know what the condition is called, but her stomach started to come up to her esophagus, and just the level of illness and the combination of megaesophagus and the other illnesses that can come with it. These are some sick babies. And I feel really fortunate that, we've been able to control it as well as we have. So, and somebody asked why not just have her sit up on the couch. You can. Many people do. Many people will get a step ladder and just have to put their front. This is just a common solution. It allows me to walk away from her and do other things, because if you're using, if you're doing 3 small meals a day and learning to sit with your dog and hold them for a lot of time, especially if you're working. So this I think was just designed as a convenience for people, and it allows me to go do some other work in the kitchen or something else today, which is just why we went with it. Yeah. Lots of options. There's always options. You're not done. Stop it.
Sterling also chimed in. Sterling was our other guest that has experience as a breeder with Megaesophagus. He said, I have never used a chair with my Dean. I fed him in a sitting position and had him sit for 5 to 10 minutes after eating. When he was tiny, I held him. But then I just let him sit. I would see his tummy pouch out, and I knew the food was in his stomach. Once he was on the bed, the food dropped quickly into his stomach. And someone was asking about the collar for you, Debbie. Does he wear the collar all the time, 24/7?
Yes, he does, because I'm a hypervigilant mama. She's used to it at this point. I like the fact that it's just going to lay down and take a nap, that her head's not her head's not going to drop below her esophagus, the rest of the esophagus. She hates me. Oh, well. And she's the parents because they're like a Saluki. Oh, my God. I mean, this is, if I'm stepping on somebody else's time, please let me know, but I have the funniest, actually most horrible story about how damn smart they are. I have a house full of poop eaters, and don't judge, there's lots of reasons. We got her a basket muzzle to try and stop this problem, and it was, it's a heavy plastic with the holes on the sides, in the front, that allows them to drink water if they go outside. So we were trying to just to keep her out of the poop. She would go stick her head in puddles and drink what she didn't really wanted to do either. But when she found she couldn't get at the poop, she would squish the muzzle down into the poop and get it inside of the muzzle. So I taped up the front holes and so she couldn't squish it in there, and then she started squeezing it inside, at which point we gave up on the muzzle and decided we needed to keep her much closer out on her out in the yard instead of relying on passive methods because her flat. Other pictures of the dailies. Yeah, I had 2 photos that Chris had sent me of the dailies there just because we were getting so many questions about it. I figured we had decided we weren't going to do them since we had the live demo, but I figured more information. Oh, okay. Yeah. Thank you so much, Debbie. Let us, we have someone coming in, let us ask Michelle Ridnour. I'm going to remove the pin on Debbie, and then I will pin Michelle. And Michelle is a breeder who has experience with Megaesophagus. All right, there you go. Take it away, Michelle. Hi, guys. So back in 2013, I had my first Saluki litter, and there was one little puppy in that litter who was very creatively named Mr. Viz, who was the boy grizzle in the litter. And as he was growing, he does have secondary Megaesophagus. He is the puppy that Chris mentioned with APIAA, so a persistent aortic arch. So he was growing. I kind of put it off at first, going, well, he was fine until I started trying to wean the litter. Once I started trying to wean the litter and get them anywhere past a soupy gruel, he wasn't eating well. He seemed like he was choking on food, and I'm going, well, maybe he's just gulping food, trying to eat too fast. So I would take the whole litter back down and stuff and say, okay, he's just not quite there yet. It was a litter of food. They're competing for food. Could be lots of him, right? So at about 6 weeks, he was eating like the rest of the litter. He wasn't eating dry kibble without throwing it up. He would cough it back out. But he would eat softened, puppy mush, canned mixed with softened kibble, which is what I had all my puppies on anyway. I started noticing at about 6 weeks that he was developing that bulge right there, and in a Saluki puppy, you know how much you can see of them. You can basically watch their heartbeat. There's that, they don't have a lot of body fat to them. They don't have a lot of muscling at that point. So you really see what's going on. So I had the litter with me at a dog show, and I have my vet just showed up. And I had said, hey, this is going on with this puppy. Could you take a quick look at him real quick? And he came back to my motorhome and took a look at the puppy, and he says, he's like, I don't want to, jump to conclusions, but I really need to see him in the office on Monday. So, okay, so we go in, and my vet, I love him. He does not sugarcoat things, so, and, at the show, he's like, this is not going to be good news. He's like, you need to be prepared. He's like, this is not a good thing. And he's like, I don't know for sure. So we went in, he did an x-ray, he kind of watched what the puppies did. We ended up doing the barium swallow test. And it was quite obvious that a large pocket had formed right here, and food was getting stuck. So he would almost, it looked like an owl pellet, when he would regurgitate, so as soon as we started trying to give him regular food, he would regurgitate what looked like an owl's pellet. So you would see like a hard, circular, kind of elongated pellet of food. It never made it. It was whatever it went in looking like is what it came out looking like. I moved him back down to liquid food. He was eating, everything went through a blender. And I was adding protein powder to his food to make sure he was getting enough proteins and liquids. And at that point, we were told, he's likely got this persistent aortic arch. He did not think it was a primary megaesophagus. He did think that there was something restricting it. He sent me to NSU. So most of you know Dr. Sanders. So we went and saw Dr. Sanders. And he informed me of what a persistent aortic arch was. So that was something I had never heard of before that day. And at that point, we were faced with, do we do the surgery or do we let the puppy go? And I'm going, okay, I'm looking at about $4,000 worth of surgeries. What's his life going to be like? This wasn't a puppy I was even keeping. He was getting placed into a pet home, and I'm going, what do I do? And any of you that know me know I am a major softie, and I sat there holding that puppy crying for days. And he was the happiest puppy. He was the sweetest puppy. Nothing fazed this little dog. And I was also now hand feeding him. So I would sit there every time I fed this dog its liquid mush and just cry. So I decided that I wasn't going to be able to sleep at night if I didn't do the surgery. But one way or another, it was money. I will make more money. I will figure it out. But I had to come up with a way to do the surgery. There was just no exception in my mind. And everybody has to make the decisions for themselves, obviously. But I knew for me to be able to sleep at night, we decided to do the surgery. I was told, we didn't know what his outcome was going to be, that they would go in and remove the arch, but that the damage to the esophagus had already been done. So, unlike a lot of muscles, you can repair a lot of things in the body. You cannot repair a damaged esophagus. So once it's stretched out and damaged, that pouch was always going to be there. Those rings in the esophagus were always going to be stretched out. So I had the surgery done. That was done at about 12 weeks. No, probably about 10 weeks. So he had the surgery done at MSU. Dr. Sanders actually almost took the puppy home if it wouldn't have been for his wife and his country. That would have been Dr. Sanders' surgery. So I took the puppy home and he recovered wonderfully. I did end up placing him in a pet home. Any of you, he lived with some people that had a Saluki friend, Larry Beaumont. So he had another Saluki friend, and he had an S.A.N.E friend. And if any of you know Jim Sillers, he's a vet and an HAC judge. That is actually, he had bourgeois from Jim, and Jim is a local vet in my area, so Jim managed his care throughout the rest of his life. He was not required, he did not need a daily care. For him, we kind of did the whole, process of elimination as to what foods work and what foods don't. He ended up being a raw-fed dog for the rest of his life. We discovered that is what worked best for him. He could do ground raw. We did not give him bone for obvious reasons, but ground raw or boneless meat. So he'd get chicken breast, that kind of stuff. But basically, he lived on a strictly food diet, is kind of what we jokingly called it. Anything that kept it very moist, he didn't have a lot of, anything that would get stuck, and he was able to eat. So he did eat, always standing. They had a raised feeder made for him, so he truly had to stand up to eat. We did not make him sit to eat, but he did have to stand up. Every morning he ate scrambled eggs with his dad. So scrambled eggs fit in the strictly food diet. And he lived a wonderful life. He did end up actually passing some DCM later. He was about 5 when he never woke up one morning. So the bad and the good news with that one is he didn't come down for breakfast, and his dad went upstairs to check on him, and he was curled up what looked like he was sound asleep, and he never woke up that day. But the 5 years of his life that he did have was fantastic. As far as the megaesophagus goes, it was, for him, quite manageable.
He actually never ended up aspirating. He every once in a while he would regurgitate if he ended up eating a little too fast, or somebody felt bad and gave him an extra cookie because everybody else was getting cookies and he really, really wanted a cookie. And then the humans, did learn that, just because we think he needs a cookie, he doesn't. It's not the best thing for him. So, they, figured out different ways to work it. He stayed local to me until he passed. And overall, he was a pretty healthy puppy, all things considered, once we got the surgery done. Yeah. I don't know if anybody has any questions.